Hi, today we're going to talk about how to stop fainting. And I'm going to kick off with a question to Trish. So, Trish, what are the top tips that you could give your patients who are fainting?
Right. Well, probably complicate. There's two main things, and I think one is when you're actually feeling faint and how to stop yourself then, which is the most important thing. Is when you feel symptoms, especially the ones that when you begin to recognize, if you feel dizzy or feeling warmer, just be aware that now you have a tendency to faint and that those might be signs of your blood pressure falling. And the most important thing is to take action quickly, um, and to remember that your blood pressure and your body doesn't really care whether you're in Tesco's or whether it's inconvenient or whether you'd rather have it happen in 5 minutes time when you're not in the office. It's to take action. So the first thing to do is to try and get the blood back up to your head. So whether that's to squat down or to lie down and raise your legs if you need to, but to get yourself in a safe position is the most important thing. So whether that's squatting down on a tube train, or pretending to tie your laces in Tesco's, or to lie down if you need to, and to tell the people around you that that's what you're doing and why. That's the most important thing.
So, Trish, what are some of the warning symptoms that you talked about? Say, in that example on the tube, how do you know it's got to a stage where you need to squat down and pretend to tie your laces?
Well, I think symptoms can be personal to you. So for some people, it's heat. A rush of heat might be the first thing, or it might be just feeling weak and feeling the need to sit down, or feeling sick. Some people feel it all in their gut the first time, and that's their early warning system. So it's knowing what you feel. So feeling hot, feeling tired, sometimes feeling a bit agitated. Certainly, if you feel your vision start to go, I think, or your hearing getting muffled, I would get onto the floor and get really in a safe position very quickly. Sometimes we have patients who hurt themselves because they've lost their vision and they can't hear very well, but they're still trying to get off a tube train or try and still get to somewhere else. That's, I think, for those are the really key things and key messages to, if your vision goes to funny or your hearing goes funny, get down. But if you, for example, have had a tilt test and we know a little bit more about your symptoms, or it happens more frequently to you, then to know what's personal to you and what are your key symptoms.
And I think a key that's really clear, Trish. And another thing is that if you ever see somebody who you think looks like they're about to faint, so if they become pale or sweaty or they do fall to the ground, it's very important to help them, lower them to the ground and raise their feet in the air. Some people make the mistake that it's better to keep them up and sort of try and prop them up. And as you're saying, Trish, that the key is to get yourself on the ground with your feet up. What would you do, or what would you advise if someone is on a very busy tube train and can't lie down? Obviously they must, and that's the key. Is there anything that they can do just to buy themselves a bit of time?
Yeah, it depends. I think it depends on where you are in your symptom profile. So if you've been feeling hot for a while, or you just begin to start feeling warm, and you know that's an early sign to you, then you can employ your isometric exercises. You can cross your legs and tightly and tense up your leg muscles, and that may help. Or but I'm a great believer in empowering my patients and telling them, not to be so shy and not to keep it to yourself, but to say quite, commonly, quite loudly, I'm feeling a little faint. I need to get down on the floor, and then people will move. If people, I think very much, if people know what's happening, that they will make space and they will help you to and have enough space to sort of squat down at least and to get yourself in a safe position. I think it's people tend to muddle along and try and keep it to themselves, and then they collapse, and then that causes a bit more panic. So to empower yourself, I'm feeling a little faint, I need to get on the floor. And I think patients tell me, people tend to be very, very helpful in that case, because they know what's going on, and it helps you to take control as well.
So you've given us two tips, Trish. One, take early evasive action when you recognize something is about to happen. Number two, do isometric counter-pressure maneuvers. And these are exercises where you clench your gluteals, your quadriceps, and typically your calves. And the idea is to squeeze these muscles to push the blood back against gravity up to the heart, to improve the blood pressure and to improve the blood flow to the brain. What else can patients do, for example, say before they leave the house in the morning, before they get on that crowded tube station or to Tesco's to help to minimize any episodes of fainting?
Right. So what I've described so far is very much in terms of what happens when you are in the moment, in the acute phase, when you think you're going to faint, you have those symptoms. But far more importantly is the prevention side of that. Stop yourself getting in that position. So it's understanding what your triggers are and helping your blood pressure system maintain itself. So in the morning, it's hydration. Yeah, in the morning, you're driest, and particularly if that's a trigger for you, you really have to be careful. So you know before you get on that tube train, you need to have taken fluid, not just tea and coffee, non-caffeinated fluid, and had some salt in the morning to help your hydration. Maybe think about what your route is into your commute and which tube you might get, and when it's not so packed, maybe that you might be able to get a seat. Even dressing appropriately for the weather. These are all things that's the prevention, thinking about what your body likes, what it doesn't, what might trigger a faint, where you're going. And that's the prevention phase of that. So, but in the morning, it's hydrate. If you need to eat in the morning and that's something you really need to do, then make sure you have breakfast, have your salt, think about the day ahead and what you're going to do.
So it sounds like a key message there is being prepared. And planning your day ahead. That's very sensible. Some patients I've spoken to, so they have a bag, a sort of syncope bag with them that's got lots of water, salty snacks, sweet snacks that they can take if they're feeling unwell, and that's quite a good idea.
Good, guys. So we've got the isometrics, the evasive action, we've got salt and water. On a practical note, how much water, Trish, should one drink before leaving the house? And how do they drink it? Do they stagger it over half an hour, or do they take a big gulp before they leave the house?
I think, again, that depends on I think it can depend on the individual and how your bladder works and how long your drip is. But I think in the morning, first as you wake up, I think you want something salty and you want a good sort of pint of water. And then to have fluid with you for the journey. I think it's there's no, I think with many of these things, the same way when you take salt, whether you take a salty snack or whether some people take a salt shot, it's an individual thing. Not everybody's the same, and you have to find what works for you. Sometimes we have patients that said, oh, I've tried this, so therefore I can't, that hasn't worked for me, so maybe I can't take salt. There's no one way of doing this. You just have to sort of find a way that works for you according to what your symptoms are and how you are.
Okay, team. So, these things that we have recommended are principally to do with the diagnosis of vasovagal syncope and how to manage this. This is when your blood pressure falls when you're standing for after a long time. So, Mel, question to you. I've heard some of my patients, and yours in particular, benefit from compression in the lower limbs, but also abdominal compression. So can you tell us a bit more about what the role is for compression, and practically how do we get our patients to get compression done properly?
That's a really good question. And these are really good tips and hacks for people that are at risk of fainting and vasovagal syncope in particular. So when we stand up, and we've had another chat about this on another recording, when we stand up, the blood in our body, a third of our blood volume pools in our legs. And that automatically sends some signals to the heart, which then sends signals to the brain saying there's not quite enough blood getting up here. Now, in a healthy person that doesn't faint, there are immediate reflexes that can compensate this very quickly, and most of us can stand up without even noticing. But in people who faint and those who suffer from vasovagal syncope or POTS, those signals don't quite get to the brain. And so the body is assuming that this blood is pooling and pooling and there's not enough blood getting back to the heart. So what we want to do is send the blood back to the heart. And compression stockings are a great way of doing this, because they stop the blood from pooling in the legs and the pelvis and the waist, and they literally compress and push it back to the heart. Now, the things that we know work they're like tights, compression tights, but they have to go up at least to the top of the thigh, but ideally the waist. So compression stockings going up to the waist have the best evidence in studies. It's not enough, unfortunately, to have them going up to your knees. There's something else, which is abdominal compression. So anything like a corset or compression underwear. So anything as simple as shaping underwear might be sufficient, but there is also medical grade compression underwear. And brands that we often recommend in our clinic are Sigvaris, which is Sigvaris, or Bauerfeind, Bauerfiend. And these are medical grade compression that you can buy, and they often do work. One thing to say is that not all patients find them completely tolerable. They can be a little bit clunky, but if you wear them, particularly on days where you know you're going to be standing for long periods of time, they can be very effective. The best evidence in terms of studies is for abdominal compression, and that's just because there are loads of blood vessels in the tummy where the blood can pool, and sending them straight up to the heart, which is not so far, can be very effective.
Thanks, Mel. That's very, very clear. There are some of my patients who actually only have symptoms once every 4 to 5 months. For example, when confronted with a situation like having blood taken, would you recommend that those patients wear compression stockings every single day?
No, because they can be uncomfortable, and they can be. Clearly, that it's not a problem every day, but this is more a situational episode. However, if the patient knows that they're going to have a stressful situation, so if, for example, that that it's very hot weather, it's the middle of summer, they're feeling a little run down, or they're going to have a blood test, or for example, to donate blood, it might be an effective tool to put them on that day. So again, as Trish was saying earlier, it's about planning and preparing.
And also empowerment, Mel, I think. Many patients will say, I know when I have blood taken, it's a trigger for me. But when I go, the phlebotomist might say, oh, you'll be fine, and have them seated in the chair, and then they get into trouble. And again, it's encouraging patients to say, no, really, I think, I should have my legs up when this happens. Or so again, it's the empowerment side of it. You know your body, you know your position, and then in a nice way, plan that and to stop it from rather than sit there and think, I know this may not end well, but I'm too timid to say something. Speak up. They'll thank you for it.
So I love the ease that we've talked about so far, and I hope this short session on top tips to prevent fainting has been helpful. First of all, to educate our patients as to what to do, to empower them to take the appropriate actions to help them prevent syncope. And another E I'd like to throw in the equation is to have the expectation that you can handle it, that you can recover and stop having syncope. And I guess that leads to a gradual improvement and a self-fulfilling virtuous cycle of improvement. Because one of the things in our group over at Stop Fainting that we've realized is that when patients take control and understand that their symptoms are entirely within their control to improve and to understand, I think this is the way that we can stop fainting. Thank you very much.